Good afternoon, everybody, and thank you for taking just a few moments to look at a product that I'm really excited about utilizing with my clients. I have on the phone with me today Gray Mason, who's the Executive Vice President of Exchange EDI. Gray, welcome.
Good morning.
Gray has a product here that we're partnering with and going to start rolling out here shortly with clients. We're testing it here in another office within the next couple of weeks, hopefully. And here's what happened. I was meeting with clients and looking at their accounts receivable and finding that their accounts receivable are starting to increase, especially in 2014 as people were on higher deductible plans. And in the medical area, that's happening a lot. In dental plans, that's probably not there yet, although I do believe that in dentistry, patients are going to see benefits cut based on costs of health insurance maybe going up and employers having to cover that cost. They may say, hey, look, we've got to give up something, and dental might be one of those areas that they do. And if that happens, that just means we're going to have more patients that are going to pay for their dental services out of pocket. And when that happens, you have to have a mechanism for the patient to pay. And if it's not an insurance card, it might be a payment card, whether that be a credit card or a bank card of some way. So been looking hard at trying to find a mechanism and a method for collecting that money and storing those cards securely and under the right compliance, basically under the red flag rules to be able to do it properly for an office. And I came upon Gray Mason and Exchange EDI, and I'm really excited about this product. So I'd like Gray to show it to us today for the dental practices that we work for. So Gray, I'm going to turn the presentation over to you.
Thanks, Mike. And good morning, everybody. It's very interesting in this patient payment space, and you're looking at a slide on the screen, the current environment in healthcare today. It's across all continuum, portions of healthcare where this constant chase of patient pay is very challenging. And when you look at some of the statistics out there today, and they talk about in 2010 the billions of dollars that patients are paying versus 2015 and the high deductible plans that are occurring out there, it's just a constant chase. And the problem is now you're seeing that in the second bulleted item, the bad debt is now starting to follow behind it. So as we start to chase more and more folks with those types of issues, as you can see, the family deductibles or just deductibles in general across the board are through the roof. We're chasing folks now year-round for money. It's not ending in Q1. And in fact, when you look at it today, healthcare practices today in general are reporting that their contribution of patient pay was in single digits just 5 years ago, and now it represents a major portion of what that bottom line looks like in their facilities. So what we've got to do is we've got to be able to change this mentality here, right? Because when that patient gets out the door, where the challenges start. And the United States average across any kind of healthcare facility today is that they're averaging 3.3 statements before a patient will pay their bill. And we all know the expenses that go behind it, and we'll show you a little bit about what that means. And then if this system fails, then we typically will outsource that to a collection agency thinking that we'll have a great return on it. And you look at if you give them $100, you notice that the return is very small. $15.77 is the United States average. And by the way, when you do turn that over, that group usually keeps 20 to 40% of that number, so it looks more like $9 out of 100. So the problem is the patients have this game figured out. We've got to change it, though. We've got to change it up so that it's not so much a reactionary business, but a more proactive, and what Mike has spoke about, with credit cards on file and starting to, treat this so that when a patient does leave our facility, and if they don't have the means to pay for it all up front, let's set something up that gives us a guarantee that we're going to get our money somehow, some way in the backside of this. So So here's our web-based offering that we have, right? This is the Exchange API. It's a web-based solution, meaning that anybody that has internet access in the practice, you can give them a login and a license, and then naturally everything is trackable from an audit perspective, that you can see all the financial activity. This will be your new payment, your cash payment, check payment, credit card payment vehicle that you can use moving forward. So when you log in, we have connections, meaning that it communicates to your current, practice management system that you're using today in your dental world. And it's very simple. It can pull over appointments, pull over demographics. Very simple, very easy to do. But within this area here, and I'm going to pick on Dan Davis, let's talk a little bit about, just how do we take money in general today, right? So if Dan Davis wants to make a payment today, it's a simple go into the payment mechanism of what he owes for that visit today. You can tag it to an encounter number. You can tag it to a data service. And then you click Continue. You can either take a card that was already on file, or if there's not a card on file, you just say, I'm going to swipe a new credit card in here. And everybody has a little plastic card reader, and there's Gray Mason. I click on Continue, and whether this patient's in front of me or I'm talking to him over the phone, I can print him a receipt or email him a receipt right on the screen and be able to get that off to him. So very easy. Everybody now doesn't have to get up and go look for the credit card machine. They can all do it right from their own desktop off your existing computer equipment. All right. One of the other major things that within the system itself, besides just the payment plan, is very big, is the reoccurring payment plans, right? This is in a HIPAA-compliant, PCI-compliant portal, so that now when Dan Davis owes money and we find out that, again, he might have a crown work, he might have, something very expensive in the offices that is done, and whatever that is, if it's $500, whatever that dollar amount could be, we can put him into a payment plan. The payment plan is fully automated, so when you set that up, the system's going to go retrieve that every month. We've had lots of folks say, can I pass along the cost of what that is to a patient, or can I set up an administration fee to the plan if you wanted to do that? Can you set up, the frequencies of, is it a one-time plan or is it a payment plan? How frequently do you want that plan to occur? And then do you want to pass along the MasterCard and Visa fees to your patient? You can do all those different types of things out there with the plan itself. But once you have this set up and you discuss with the patient what credit card or what checking account would they like to leave on file, and you can have a primary and a secondary, you pick the targeted date, and then when do you want that to start? So you have all the mechanisms in here right now with the patient to be able to do that. Once you click on the Save and Activate button, it is now set up so that that automated payment plan is ready to go. You can give them a very full, detailed plan of what it looks like for Dan Davis of the $500, talking about, were there fees associated with it to set it up, talking about, the frequency of the plan, getting the patient to initial it, and by the way, your logo, your information sits up on the top, and then a final signature that says, yes, you're good to go. Let's fire that thing up. So when you're going through those options, again, the idea behind it is now I have either a credit card on file or I have an automated payment plan that I've given the patient the ability to be able to collect money once they leave my facility. Our solution can actually what we call auto-settle that credit card on file, meaning when you have a balance that comes back and the payer says Gray Mason owes $50, our system can take a look at that file that comes back, go back and look in the archives of your patient, Dan Davis, to be specific, has left his credit card on file, and it allows me to say, Dan has said that I can collect up to $50 or $100 on his credit card. I can go out there and settle that. And prior to settling that, I can send the patient a pre-notification in the system so that it will actually tell the patient in 72 hours, we're going to go auto-settle that $50 that you owe. And that messaging is fully customizable so that you can go into the system, at any given time when you want to be able to talk about, that outbound messaging, how you want it to look and feel, and all that good stuff right underneath the tab here. Okay? So as you now have a communication tool to be able to grab, information from the patients, whether it's pay now, pay later over a period of time, you're now able to, stop the madness of sending off statements as you chase folks. And in fact, if you look at it, we have a little, what I call an ROI tool, and we talk about, within your facility today, if there's 2 dentists, and, you're averaging that national, 3 statements per patient before you get it, and you're seeing 30 patients a day in your facility, and you take off 4 weeks a year, this exercise will tell you how many pieces of paper you're sending. Well, our national average shows us 50% of the time. Our groups are getting a card on file or an automated payment plan. And if you think about it, your staff only has to learn 10 words, and it goes something like this: "Hey, Gray Mason, can I keep your card on file for any future balances?" And our groups 50% of the time are able to do that and higher. But if you're at, that 50%, what does that look like for you as an organization? That means that you're sending out 12,000 pieces of paper every year to try to collect patient balances. And all the experts, like Mike on the phone and other consultants, will tell you that that number, after you add in the postage and then the labor efforts, is pretty high and much higher than this number that we use as an average. But take a look at that. Look at the efforts of, $36,000 could come back into my practice if we flip over to a solution like this, and my staff, all they have to learn is 10 words to say and change their merchant processing from swiping on an old, merchant processing credit card terminal versus the virtual terminal where I can store the card on file. What a great return that you could start.
One of the things with dentists is that a lot of them are more sophisticated, even in the medical market, with the physicians versus the dentists. They have the swipe cards and work with their systems and so on and so forth. So would this system work right alongside of that? And then could you talk just a little bit about the merchant service and what you do with that, how you work with that with the client?
Yeah,
they would have to switch, right?
Absolutely. So it's a new merchant agreement. We are large enough that we can state on the phone that we will better your rates today from your merchant processing. So think about that old credit card machine today that you may have it hooked up to the phone line, or it may be even connected to your current system. But what we're finding is a lot of the systems today can't store the card or set up a reoccurring payment plan. So you can only take demand payments, and then you let the patient get out the door. And the big change for us is that now you have the ability to store that card in the system so that you don't have to chase that patient any longer, that credit card is out there. And when you want to take that payment, there's the card stored. You don't see the full number. It's fully compliant from a PCI perspective and from a HIPAA compliance. So you really stop chasing your patients for balances. But yes, it works with your current system. You'd be in a new agreement with better rates, but superior functionality, and bottom line, get rid of the labor cost and the bad debt that you can enjoy with a solution and a tool like this.
Awesome. I'm really I want to thank you, Gray, for this opportunity today, just to take a brief look at this product and what you have to offer. I think it's an awesome thing for practices, healthcare practices that want to get that money up front. And it's not to be greedy, but you do need to collect that money and to stay viable and profitable in your practices today. And the sooner you get it, the better. So appreciate this. I think it's be very beneficial to a lot of practices that we work with, and I'm looking forward to rolling that out. If you're looking at this particular video and you'd like to learn more about it, you can contact me at Vanderlick Mulder DeVries and Elders, 616-949-9030, extension 12, and we'll set up a meeting to go over this with you, and maybe have Gray give you a little more details on pricing and the backbone behind this thing. So, Gray, thank you so much for today, and everybody else have a great day.